Okay, now we are ready to demonstrate our second medication, which is our liquid medications. So the first thing that we're going to do is wash our hands. And we need to identify and gather our supplies. So we want to have our medication container, our measuring devices, our gloves, and our monthly medication record and our parent authorization form. And I've got a pen to document. So the first thing that we'll do is our first medication check. So I'm going to compare our medication container. So for Joey Doe, we have amoxicillin. It's 125 milligrams per 5 mLs pediatric suspension. We are going to give 5 mLs every 8 hours at 6 a.m., 2 p.m., and 10 p.m. It's for 7 days. And our special instructions are to shake well and to refrigerate, and we are to discard after 10 days. So we can compare here with our monthly medication record. Amoxicillin, we are to give 5 mLs by mouth, and we are going to give the 2 p.m. dose at childcare. And we have that Jane Doe has signed the medication authorization form for us to administer the amoxicillin 5 mLs pediatric suspension at 2 p.m. by mouth. And we are giving this for a respiratory infection, and it's important to note any possible side effects. Could be nausea, rash, itching, diarrhea, or vomiting. And our special instructions are to shake well and discard after 10 days. We read our label for any special instructions, so we're going to shake it well and refrigerate. Shake. And our medication is not expired, so we'll go ahead and do our second medication check. So again, we'll check that it's for Joey Doe, and we're going to give the amoxicillin 125 milligram per 5 ml pediatric suspension. We are going to give 5 mLs at 2 p.m. And so we have amoxicillin 5 mLs at 2 p.m. for Joey Doe by mouth. And our parent authorization on the back for Jane Doe, sign that we can give Joey Doe the amoxicillin 125 milligram per 5 ml pediatric suspension. We are going to give 5 mLs at 2 p.m. for a respiratory infection. Okay, so we can open the container. My bottle doesn't open, so we're going to open the container, and when you pour your medications, your liquid medication, you want to pour it with the label up. So, for example, we would pour it like this. We don't want to touch the inside of the bottle, the cap, or the medication. So I'm going to pretend to pour 5 mLs into my container. Or you can use a syringe, and I filled it to 5 mLs. Sometimes you might have a syringe with the end that looks like a spoon, and I don't have a good way to fill this without it spilling on my desk, so I didn't fill this one, but you would just fill it to the 5 ml mark on this device. So then you want to make sure that the medication, when you pour it, doesn't spill onto your label. Some medications can form a dome when you pour your medication. So what you'd want to do in that situation is put your measuring device on a level surface, and you're going to get eye level with your measuring device and make sure that you've accurately measured 5 mLs. One thing that's important to remember with liquid medications is that you don't want to mix 2 different liquid medications together, and you never want to put liquid medications in another liquid. So we would never put the amoxicillin in a bottle of breast milk, or we would never put the amoxicillin in a little cup of apple juice. So that's not the way we want to administer our medications. We want to just administer the medication. So we are going to replace the lid back onto our medication container, and we're going to take our medication and supplies to the child so that we can explain the procedure. So once you bring your medication to the child, you're going to do your third and final medication check. So with Joey, we're going to compare our medication container. For Joey Doe, it's amoxicillin, the 125 milligram per 5 ml pediatric suspension. We are going to give Joey 5 mLs at 2 p.m. We've shook the container well before we poured it, and it should be refrigerated. So our double check, we have our 5 mLs of amoxicillin, and we're going to compare our medication, monthly medication record. So we have amoxicillin, we're going to give 5 mLs by mouth to Joey Doe at 2 p.m. And we have our parent authorization form signed by Jane Doe that we can give Joey the amoxicillin 5 mLs by mouth at 2 p.m. So then we can put on our gloves. And then we can place the medication cup to Joey's mouth, or we can assist him to place it to his own mouth. And we're going to allow him time to swallow the medication and give him a drink of water. We're going to ensure that the entire dose of medication was administered. We can take off our gloves. We're going to wash our hands. And the administration is complete when we document on the monthly medication record. So I'm going to initial that we gave Joey the medication at 2 p.m. so we can return our medication to the proper storage area. So in this case, it needs to be refrigerated, so you're going to return it to a locked box in the refrigerator. We can clean up our medication administration area. So I will throw away my gloves. And I am going to clean my medication administration area. And then we can return, if you're using a syringe, you want to clean it and return it to the lockbox with the amoxicillin. And then we're going to observe Joey for any of the adverse side effects.